I am interested in what you've just raised. If Jibola can clarify, can say something to what you just said, I think I will be happy. Hello, viewers. Welcome again to the opinions. This week again, we'll be talking about some of the reports that we have had. We had recently about the prediction on the rate of deaths on Black people in some times to come. And today we might also be talking about some other things as well regarding the coronavirus. But before we move on that, I have with me online, I have Jibola Odu with me. Can we hear your voice, please?
Hello, everybody. Good afternoon.
And I have with me Didi Mbikan.
Hi, everyone.
And again with me, Ngozi Ochuba.
Hello, everyone.
And I have online with me as well, Pastor Uche.
Hello, everyone.
All right, thank you very much, and welcome to another episode of The Opinions. Today, we don't have to spend so much time, but I just quickly want us to discuss one or two things, especially about what people have been saying, about what the report have been saying about the Black community. I'm saying this in order to kind of like try and encourage our community, our people in the community. We don't want a situation whereby, because most of the reports that we've been getting lately are not favorable for the Black community. And like someone has said, where do they, is there any fact that this is even going to happen to the Black community? Like one of the reports that we got is about the prediction on the Black community that there will be high rate of death, which is going to be 4 times higher than the white community. And with me, I have, let me quickly go to Ngozi to say something of this. What can you say? Because we don't want a situation whereby people will start to have, will be affected negatively because of this issue. And we want a situation whereby we will talk about what we need to do in order to help our community to understand what they like. You know, in the past, we've been trying to get the fact about COVID-19, but to be honest with you, we've been hearing a lot of things, we've been told so many things, but I can still say to you that so far so good. We don't have 90%. I don't think we have up to 50% of the facts behind COVID-19. But for this report, what do you have to say to people out there on it? Ngozi?
I'd say that my advice would be that they should all remember that it's a prediction. There's a difference between something being a prediction and something being a fact. Where did the predictions come from, you know, and from what country did they make those predictions from? That's another thing that we should look at. So I would advise people to sit tight, keep doing whatever it is they're doing to stay safe, and let's see what happens. There are no statistics to show that more people of color have passed from this virus, or less people of color has passed from the virus. So we've got to be really careful what information we feed ourselves and try not to let ignorance and fear, you know, cloud our judgments.
All right, thank you. Jibola,
Yes.
recently, I remember maybe in the second week when we started discussing about COVID-19, I made mention of something, or no, I think it might be second week. I made mention of something about Bill Gates. He spoke about this pandemic, I think about 5 years ago in 2015. And Barack Obama also said something relating to that. We've seen so many videos in the past that have predicted what is happening now. And that is not what I even want us to talk about. But what I'm thinking now is, who is Bill Gates? I know Bill Gates is not a scientist, it's not a doctor, it's nothing, it's no one that you can really associate with, that can be associated with any medical record. Why is Bill Gates talking about vaccine, and why is he recommending that vaccine should start to be tested in Africa?
Okay, thank you very much for that question. Before I answer the question, I'm going to digress a little. I'm just going to go to the first question you asked about the BMEs. I'm tuned to CNN right now, and every day I listen to Governor Cuomo's update on COVID-19 in New York. And one of the things that flashed now when Ngozi was talking was that the governor said, indeed, the BMEs, the ethnic minorities, have been adversely affected by COVID-19, especially in New York. And if you're using New York as a yardstick in comparison, when you're looking at the vast numbers of people that have died in America as of today, 77,000, and of the total number of people that have been positively affected, 1.2 million, and a governor who manages the state of New York, which is the third largest city in state in America, we're telling you that, then you must be very careful. Now, to come to Bill Gates. Bill Gates is a multi-billionaire, owner of Microsoft, and a philanthropist. Maybe all of us are not aware, but Bill Gates was positively involved in the elimination of polio in Nigeria. In fact, he donated billions to that effect. And because of his efforts and the polio was wiped out in Nigeria. And they did that by vaccination. So Bill Gates has been involved in the medical field, contrary to a lot of people's belief. There's been a lot of conspiracy theories about Bill Gates and his intentions and everything. You did mention Barack Obama and Bill Gates warning us about pandemic. Yes, when Barack Obama was president of America, we had two issues. We had I've forgotten the name of the pandemic, the thing that came from Asia. I think it started in Singapore or Taiwan. The bird flu thing. We had the bird flu. And that was when they set up this organization under the WHO and the American CDC that was based in China. That scientists and intelligence people predicted that at that time when Barack Obama was president, that the next big thing in terms of pandemic was going to come out of Southeast Asia, probably China. And that the only way mankind can save itself is to have early warning systems put in place, isolate it, and destroy it. So what did they do? The American CDC set up office in China, especially around Wuhan and all those areas. But I don't want to go to politics, but I don't have a choice because I need to explain this. But when the present president came, he got to the office, he removed everybody. He had about 1,000 staff. He sacked all of them. Scientists, doctors, immunologists, epidemiologists, name them, they were all there. He sacked all of them. He drove all of them out. So the early warning system, the ability to analyze, identify, isolate, and stop this thing was completely gone. 2 days ago, the same Governor Cuomo said, when this thing came into New York, this COVID-19 did not come to New York from China. It came to New York by Europe. In other words, COVID-19 left China, came to Europe, mutated in Europe, and then flew into JFK or whatever airport in America, landed in New York, and then stayed. Between the time they closed the border, they closed the airport, or they closed flight from China, over 3 million Europeans that flew into America. With 3 million Europeans flying into America, some affected, some not showing symptoms, going all over this place in America, it's easily spread. In March, you had only 15 positive, but in May, you have 1.2. Will tell you the volume and the way it has spread all over America. So what I'm trying to say again is the stats from America has been very right, which if we can use that as a snapshot of the whole world. And that is where Bill Gates came in again. The stat says that the ethnic minorities, the blacks, the Hispanics, basically the ethnic minorities have been adversely affected. Both nurses, doctors, and even patients, especially those with underlying health issues, diabetics, high blood pressure, anemic, they've been adversely affected by this, not only the Caucasians. Bill Gates has been in the center of this, pushing for vaccine, investing his money in this. He didn't have to do it. But I mean, if he keeps quiet and does nothing and the whole world goes down the drain, he would go down the drain too. And so when he's talking about Africa, Bill Gates has made many trips to Africa, especially Nigeria. So if you say Bill Gates doesn't know Africa, you might be totally wrong. As recently as Dangote's last birthday, Bill Gates was there. As recently as Dangote's last birthday, he was there. He was a guest. Okay, and he donates money to Nigeria health services, especially in fighting polio, like I've said. So he knows the way Africans have been living. We live in communities in densely populated areas. This COVID-19 is not a disease that does, what I mean is that COVID-19 is a disease that can be stopped when there is social distances. But in Africa, the way we live, it's not possible. And Bill Gates has seen it firsthand. Bill Gates has gone to IDP areas in Borno. He has visited Kano. He has visited Kaduna. And that is where the polio was very ripe. And with his help and his foundation, we're able to declare Nigeria polio free. So I think I've given snippets on all the areas. I'll just pass the mic now. Thanks.
All right, thank you. Didi.
Yeah.
With what Jibola said,
yeah,
if you agreed with him, and also from the report that we have had so far, and that was reported mostly in US, well, same thing here in the UK, that it really affected the Black community seriously. What do you think? What are the factors that contributed to this?
Well, first of all, it's good you're not asking me who Bill Gates is and whether I actually incline to him, because like every human being, I have a right to incline to who I want to incline to.
Okay.
And that is just me. Having said that, perhaps I will touch a little bit on Bill Gates as well.
All
okay.
Right. Thank you.
Maybe not really commenting on him, perhaps asking Jibola to expatiate more whether there is a kind of string attached to all those philanthropic, in quote, work that we have seen him do, okay? Because I have seen a clip where Bill Gates tends to better the climate, okay? So he put up an equation and he said, look, to reduce the carbon footprint on the earth, that these parameters will have to be considered, because these are actually the parameters on the other side of the equation that contributes to the carbon footprint in the climate. Of course, we know what climate change is doing to us as a people, okay? And in those parameters, one of them was that it has a people, it has, okay, reducing some kind of industrial activities and all that. And it says look, one of those parameters have to go to 0 for the left-hand side, which is the carbon footprint, to go to 0. Okay, with my little knowledge of mathematics, I know that if you have multiples and take 1 to 0, then everything becomes 0. And it says that we can reduce that by a fraction, okay? And it wasn't talking about any other parameter other than the people in that set of parameters. So the question is, if you want to reduce the number of people on the planet Earth, okay, why are you so interested in saving them? That's the question. If I see him face to face, I will ask him, are you going to swallow your words? You said this out. You said to us that this is what is going to happen. Of all the factors, this is the only factor that you deem necessary to reduce. You want to literally kill the people so that you can reduce the carbon footprint. Okay, it's good to reduce the carbon footprint because the change in climate is not doing us any good, all right? But is there not a conflict of interest if at one point you say you want to kill people, at another point you say you're finding something to save the people who are dying? To my mind, there's a very big contrast. And it's not just an ordinary contrast, it's one that needs to be looked into severely before any such thing is accepted, okay? Having said that,
Before you go on,
the fact that it's been predicted that,
hello,
yeah,
Didi,
yeah.
Before you go on, I am interested in what you've just raised. If Jibola can clarify, can say something to what he just said, I think I will be happy before we go on. Jibola?
Yes, sir.
Did you hear everything that Didi
Yes,
said?
I heard everything he said.
Okay, because
I'm not,
I understand that Bill Gates have been around almost everywhere in Africa, and he has been doing that. And from what he said as well, I heard about it, and every one of us heard about it. Why is he trying? Is he trying to play a kind of saint at the same time? Should I call it a political saint to the black people?
No, well, let me quickly say this.
Yeah.
When I spoke, I wasn't holding brief for Bill Gates. I was just trying to put things in perspective. I wasn't holding brief for him. This equation that Dede has quoted, I'm not aware of. This statement by
everywhere,
Bill
all
Gates,
over the internet.
I don't listen to all those conspiracy theories and everything, because I find out that a lot of times people are taking things out of context. They'll just pick up something and paste that. And then there was another one that I was seeing that they put up a signature thing in White House for Bill Gates to be investigated. And that was fact-checked by the CNN just 2 days ago. And they said it was all fake news. Like they said it was all fake news. That they said they have over 400,000 signatures. That was all over WhatsApp and all that. So honestly speaking, this equation
Do you know, for every rumor, there is element of truth.
I'm
rumor just fly. There must have been something that brings that. I know people can turn things around.
Whether it's rumor, like Ngozi had said earlier, there's so many things flying around. So you have to be careful what to listen to and what to pick.
Okay.
Whether it's rumor or otherwise, I do not know. Okay. I am tuned to CNN. CNN is a verifiable news, and they have corporate value and everything. So they have their image to protect. If they make a mistake, they will make a retraction. Okay. And before they put it out there, they will make sure that it's fit for purpose and it's the truth. So on what Dede has said, I really honestly cannot comment. On the equation, on everything he has said, it's news to me. This is the first time ever. Okay. I've tried to avoid anything about Bill Gates because I've not done any further research on him or his activity. The only thing I know is the Bill Gates Foundation that has been the forefront, just like the MacArthur Foundation in Lagos has been the forefront of both healthcare and providing portable drinking water, fight against polio, fight against HIV and all. They've been a lot in Africa, especially Nigeria.
All right, we decided to put that back to you because of what you have said about Bill Gates.
I wasn't
From the onset. You have painted him like a saint, as the best person. Somebody who has been fighting for the black. That is why we decided to put back.
Okay.
Put it back to you.
Can I just say something at this point? Okay. Well, we know that things are flying about, and we know that there are mainstream media, but it will be an error to think that the mainstream media is not influenced by any means. That will be an error. For instance, take YouTube for instance. Okay, there was a video done by one Dr. Is it Buta or something like that, and this guy has fact. How you authenticate a thing is when you can put time to it, you can put a name to it, you can put a place to it. It is verifiable, it is repeatable. If it's a scientific postulation, you can repeat it, and then you can say, yes, this is authentic. So they were calling names, they were calling people, they were showing places. That cannot be a lie. It wasn't cloned. Okay, so like you said, well, that is something that you haven't seen. If I come across the clip, I'll send it to you again, because the person who was anchoring that clip wasn't he's a renowned person. I have listened to him severally over the years before this time. Okay, and when he said that, I believed it, and I stand to be corrected if what he's saying is false, because he wasn't the first person that have said it. I've heard it before I saw him presented that clip. Okay, the other thing is that these mainstream media, they are not telling us everything, the whole truth. And half truth is even more dangerous than telling us a lie. Okay, because if you blend a lie with the truth, then because there's an element of truth in that lie, you are misleading the people, and it's very dangerous. Okay, so
and that is
if
what I'm
anybody takes,
about.
for one, I like the alternative news. All right. And it is left for me to apply my judgment to it or carry out my own research. But you have to start from somewhere. It's good to listen to CNN. It's good. Yeah, on some things, they are very transparent. But on certain matters, you need an alternative news to be able to, to come up with what, is the actual thing. All right. So that's what I will have to say. Let me quickly say something about the black minority dying. The Guardian, is it the Guardian? Yeah, the Guardian did state that because of our socio-economic standing, okay, and this is the Office of the National Statistics putting out these facts that yes, the black and ethnic minority are more likely to die from these diseases, just like Jibola said, because of our lifestyle, because of our attitude, all right, to simple instruction, to follow simple scientific findings, all right? Okay, call it the way Ngozi put it, ignorance. We choose to be ignorant, okay? And also because of, it is said in that document that we are poor, so we're likely not to be able to, keep ourselves from those things that we shouldn't do, all right? So in a nutshell, is basically because of the demographic record they have and our social economic standing. But like she said, if somebody say you're going to die, will you go and die because the person has said you're going to die? I think that's a very important information for us to pick up and to use to arm ourselves and disprove them. It was said it was going to rain today. Well, look at it, it's all bright and shiny. So why can't we, disappoint those statistics? It's only a prediction. It's left for us to make it come good or not.
All right. Thank you. Yeah. Pastor Uche.
Hello, sir.
How are you, sir? We are still on this same issue about our community and COVID-19. And the reports that we had is not it's not really encouraging about this situation for us. And recently, I also saw a video made by a white nurse, a lady from the US, stating how the black people were treated when they are being admitted to the hospital. That is not very encouraging as well. But what I think I want us to do here is, how do we encourage ourselves, our community? How do we get ourselves, what kind of advice do we have to give to ourselves in order for us to be able to fight through with this situation of COVID-19?
Okay, well, I have a personal experience, about this thing we're talking about. Few years back, few years back, when I first of all came into the UK from Israel, I mean, I was all right, no problem. At a point, I went to register with the GP. They took all the whatever they needed to take from me, information and all that. They took the blood samples and all that. Now, it came back that the blood pressure was high or a bit high then, but they didn't tell me. I called myself to say, you took samples and all that, so I should know what they said. No, if they don't call me, it means no, it's nothing to worry about. But the pressure was there, not until when I went for hospitalization for 6 days. And everybody, they will be asking me, did you drive yourself? Who brought you? I drove myself. They said, no, we're not letting you out. That was how I was like practically, detained in the hospital because I wanted to go back that day. You see, so this thing was known. So there is a conspiracy. I'm coming to your question. I just want to build something. Yeah. There is a conspiracy. If I come now and say 50,000 people will die here, it means I know what they do not know. Come rain, come sunshine, they will die because I know what they do not know. When you have the background, you read the history of the Native Americans, the Red Indians, what happened to them when the people banished from England got there, and after learning the skills and everything, how they dealt with those people. When you go and begin to read the history of Australia, the first people they took there, what they did to the Aborigines, what happened to the Aborigines in Australia. Now, what about the US? Remember when syphilis was killing a lot of whites, killing all whites? Black man will not have it. Even if it comes, it is like a chewing gum, nothing. What did they do? They practically, literally, it took the injection of it and started injecting black people so that they should die as well. Because they are human beings, they should die as well. Mm. So when Bill Gates said something, and now the wife also echoed it and said she see dead bodies here and there. Believe it or not, listen, I went to a church personally once I traveled to Nigeria. As I closed my eyes to pray, when I was called upon to pray, what I heard clearly in my ears was that there's a lady here, 35, not up to 35, she has menopause. And as I said it, everywhere became quiet. Nobody came out for prayer. But as I was being driven to my hotel, about 3 or 4 of them were calling. Pastor, that kind of thing, we cannot come. Most drugs we drink today, there is a conspiracy. This is St. Uche speaking. I don't know about medicine. I don't know about pharmacology or how things are being produced. There is something that has been sent to check the production. A typical Oyibo man will not have any child. They can bequeath their wealth to their dog or cat or animal foundation. They can do whatever. But those ones that that we are productive. The way we live communally. I cannot be said to be a rich man when my brother is suffering. Then I'm the poorest of all.
No way.
So they have made their mathematics calculation. They have seen how backwards they are. They have now said if anything should happen now, these people, this continent, you cannot hold the people for long. One day their eyes will open. They will begin to harness what God gave to them that is not finishing, that cannot finish. So where we will be left, what we will be left with? So they have brought war. The same people sending peacekeeping force are the people selling arms to the people fighting each other. So how can you bring peace when you are supplying arms on that? How can you bring peace when you teach politicians how to steal money? They will steal the money, they will save it in your country, they will be paying taxes from that money. Your country will report them that they have stolen money. Then they cannot take it, it becomes process of crime. The money will be used to pay weekly benefit to people, and you will say they are fantastically corrupt. Let's look at this. All these things have linkages. Bill Gates, like we said, all his Kurukere movement are ominous. There are undertones. He knows what we don't know.
Yes.
They know what they have put in for other drugs people have taken before that will make people sick. They know. And another thing I want to tell us today, quote me anywhere. Figures are dying. Human beings are not dying that much. If we hear that 50,000 people died yesterday, that 50,000 just remove 49% is 1% that died. When you want to probe further into it, they will show you pictures. They will just show you pictures. Now, this Africa, the same way they did not tell me that I had blood pressure then until another 6 years, is the same way they mistreat blacks coming to hospital. Of course, will they not die more? It's simple now. If I come and you don't look at me after me well and all that, of course I will suffer more than the white person that comes and gets the attention he or she needs. Now, your question is the antidote. What do we do? Very simple. Instead of using our mobile phones all the time to do other things we need to do, we need to search information. We need to educate ourselves. These days, people don't just go to GP. That symptoms you are having, you Google it. You will know what you are having. You will see names, you see things. Even though you reject it as a Christian, but then you have checked it out. Then when the GP is telling you what you know, you'll be shaking your head. We need to look at place. We need to learn to be safe. We need to learn to eat good, eat right, exercise, do other things we need to do. And most especially, we also need, like Ngozi was talking about when she was talking about Ebola, people drinking salt. There is one very handsome young Cameroonian man that just passed from US. I don't know if we saw it on Facebook. Overdose of garlic and ginger. You know, we have this tendency as Africans to overdo things. If they say this thing is working now, in my family group WhatsApp page now, there is this oil. They say the oil is good for arthritis, it's good for arthritis and hair growth, it's good for a lot of things. One of my brothers said it's between 27 to 30,000 naira. All my family members are sending money now, they want to buy it. I now ask them, who made this medicine? From what country? What are the active ingredients? What about the dosage? What about this or that? Then say, who do I? Please check this thing well before you begin to buy. Buying it is not a problem. The thing not working is even better. My brother is selling tablets, pharmaceuticals at Onitsha Head Bridge. Some of them use chalk and bitter cola to do it. So when you swallow it, it is bitter. But at least it will not kill you. It's just that it didn't solve the thing.
Yeah.
It's better than killing you, the one that you will take, and it will deform somebody. So what I'm saying is we should be well advised. We should be educated. When you know that, listen, odds are against me. When you know that, look, there is a conspiracy against me, you'll be careful. You'll be very, very, don't overdo things. Beware of the climate, the climate, under which we live in. And of course, keep healthy. We should continue to wash our hands. Nobody needs to tell us to wash our hands. We continue if you don't have to wear mask, don't wear it. But whenever you enter your house or you get to your final destination, wash your face. I do so, I do the same. I wash my face, not just my hands and sanitize it as well, but I wash my face. And of course, again, let's also know this 50 million died yesterday. The governor of Kogi, the head commissioner of health for Kogi State, if you go online, is there, Punch News. The guy said there is pressure for us to hype these COVID-19 cases, but we refuse to hype it. What is the motive behind that pressure? Telling to, so I have just come to the conclusion that figures die every day, but human beings don't die as much. So because when we believe that human beings die as much, our mind will begin to invite that death. So I know it's meanness, I know it's meanness. Nonsense. Listen, anybody that would die would have died long time.
Long time
Many
ago.
people hunger. Hunger has killed a lot of people. Ignorance, Sister Ngozi has said, talk about ignorance. Hunger has killed a lot of people. Bad sanitary, the way we live, the area we live, not clean. You cannot give me money now instead of buying food, I'll go and begin to buy the toll. No way. I will eat one bread and Coca-Cola first to be alive before going to look for the toll. So all these things, if we keep the environment clean and live a good hygienic life, observe health and safety as much as we do, I think it will go a long way. Thank you.
Thank you, Pastor Uche. I really enjoy your analysis because that's just exactly what is happening. The politics behind this COVID-19 is so real, and everybody can see it. But I think what they are trying to do is to create kind of fear into the people's hearts so that they will be able to have their ways. That is what I can always say with that. So, well, okay, if we move on that, let's quickly talk about the end of lockdown. Ngozi, because we heard recently that government is planning to lift the lockdown and trying to end it, but they've got so many plans in place. What do you think about this? And do you think the lockdown should come to an end at this period, or it should
I think health strategists and the people who are strategizing the way the health system in the country is probably moving forward will probably be best to answer that question, whether or not the lockdown should be lifted. But in terms of how I think it's going to affect us, lifting the lockdown very soon, like I said previously, fear and ignorance. A lot of people will not want to go out when this lockdown is lifted. Why? Because they are very afraid. You've told them that if they come in touch with people, if there are people from the BME community, they are likely to die. A lot of grandparents, BME or non-BME, would not want their grandchildren to come to their homes because they've been told that they are more likely to pass if their grandchildren or younger people come around them. So this is going to have more psychological effects as opposed to physiological effects. So like we discussed last week, I foresee a lot of mental health. I believe that a lot of people are going to be more affected in terms of their mental health. So we're going to have the mental health services is going to be more crammed, to be honest, because you have people suffering from isolation who are now isolated, and then with the anxiety of catching the virus, it's going to be so difficult to get them out of their homes. You have parents who probably will not want their children to go back to school, because trust me, for children, the easiest place to get anything, common cold, you name it, is the school. So there's going to be, fear in different sectors, and I feel like with them lifting the lockdown, as the news have said, we're going to experience so many different temperaments in terms of Do I want to go out? Do I not want to go out? Speaking from my own experience, I'm now getting used to staying home. When you go out, people are looking at you funny, you know.
Especially when you are black.
No. I don't think it's because of the color of my skin.
It's part of it, because I realized that this morning when I went out. And this is not the first time I've been going out, but in the last 2 days, the reports about black people, and I realized that some people have been like trying to avoid me as a black man because of that report. And I think that is so wrong for the government to have announced such racism reports.
Well, in my own case, I don't think it has to do anything with the way I look or my ethnicity.
Because
I think it's
another
just
thing that I'm not happy about that report is they kept on saying that, but they never said why they have made that prediction.
And this is why I said that we need to be careful what we hear. No matter, there was something they said that really made a lot of sense. He said, when you look at news channels, there is always something or someone fueling them and gaining from it. Take, for instance, during the American election, you see Fox News. Fox News will report whatever they want to report. Every other news station will report whatever they want to report. But you see that there's a particular kind of news that we get from Fox News that we don't get from the other channels. So you know that there are powers that be that are pumping, whether be it finances, be it favors. So we really, really need to be careful what we're listening to. Like I said, there are predictions. Whoever's making this prediction, or whoever they are that are drawing up these predictions, don't have facts. They're just predicting. And who's to say that these are actually real predictions? When was the last time we had a pandemic? The last pandemic was in what? Was it 1881 or something? I'm not really sure on that figure, but it's been a long time. So in order for you to make predictions, there has to have been happenings, so you can draw results from those different happenings and use them to predict. So where their predictions are coming from, I really do not know. Hence why I keep saying that we should be careful what we're listening to and the information we're feeding our minds, you know, because this controls all of this at the end of the day.
Thank you. Didi, with the prediction, do you foresee any kind of situation that is going to be, that might be arising for the black community? Because if the lockdown should come to the end now, and with what I've experienced today, do you think this is not going to cause another problem in future between the white community and the black community, especially when it comes to people working together in the same place? Don't you think this is going to cause a kind of separation between the white and the black people in future?
Is that for me or for Bolaji?
For you.
Oh, for me, I see. Okay. Well, I'm not saying that, well, you know, whether somebody's looking at me funny or, well, just like you had an experience, I've also had, you know, some experiences in Middlesbrough. I don't know whether it's obtainable any other place, but I can't go out of here until the lockdown is over. I've been to the shop more than once, okay? And normally there will be a line for 2 meters, okay?
Yeah.
I've always noticed that when I stand and a white person is standing before me, and this is my experience, this is my testimony, so I can lift my shoulders high and keep my head up and say it anywhere, anytime, you know? It doesn't matter to me. You choose to do what you want to do. That's up to you. But my experience is that no for more than twice, and I reported it to my sister. I said, look, this is what I observed. You know, whenever the next person behind me is a white person, the person keeps 4 meters away. So the other, you know, on the queue, 4 meters. It happens not once, not twice, not 3 times. And I said, look, okay, I mean, what can I say? What can I say? So if that is anything to go by, then I wouldn't be surprised that it will be a little bit of, you know, unpleasant situation for some, in some settings. I'm not sure we can generalize this for now. Like I said, this has only happened in about 2-3 shops in Middlesbrough. There are loads, you know, and I'm sure it wouldn't be the same. But if that is anything to go by, this news is not a pleasant one for us. Having said that, I'll quickly say that, well, all the things that Ngozi talked about, the mental health, you know, the fact that, you know, people will want to stay home, wouldn't want to go out even when the lockdown, well, these reactions must necessarily be, no matter when this thing is lifted. So it's better to face it now, okay? And I think that the government is properly guided. So if they say it is time to begin to ease up the lockdown measures, I think it's just time, because they are working with facts and statistics. By the way, the prediction that more Black people are likely to die from the coronavirus comes from statistics, and it is the statistics from the Office of the National Statistics in this country, published, you know, published in the Guardian of 7th. 7th was just about 2 days ago. So if you check it out, you will see where they have said that Blacks are more likely to die, 4 times more likely to die than the whites. But I think there is no better time than now, because they are working on information. Their actions are based on scientific information. And we have been told that they are using a criteria called the rate of, you know, spreading the disease, simply put, R. Okay, when the R factor is less than 1, then it looks like it's good to go. And they will do everything to make sure that it's kept below 1. Otherwise, more people will get infected, and they don't want that situation to return.
Thank you. Jibola?
Yeah.
Please, there is this video that we saw recently that a particular bill was passed secretly by the government recently, and we've been asked to go to the online. I don't know if you have come across that video as well. That
No, I haven't.
the vaccine will be distributed, and they will start giving it to people, and you have no right to ask for what is in the Vaseline. And you still have, even if you don't even feel like taking it, you still do not have right. It's more like your human rights is not really put in place with this.
Doesn't matter.
What do you think about this?
Well, 2 things from a legal point of view. Human right is relative, okay? It's not absolute. And that's the mistake the common man makes. Human right is not absolute. Because if it's absolute, then no government has the right to take anybody's life, nobody. Because where your own right ends is where another person's right starts. When you're talking about a coronavirus, COVID-19, if you have A, B, C persons, and A is not showing symptoms, but has been in contact with someone that has coronavirus, and he's saying that he should have right not to take the vaccine. What about B and C, who come in contact with A? Don't they have a right to life themselves? You know, and in that scenario, it's the government that will decide for the people whether or not a law will be put in place to ensure or enable people take the vaccine. And that's where the conspiracy theories come into play. And that's where it's the nexus between the vaccines and Bill Gates, and what they said about Bill Gates saying the equation of reducing the carbon footprints Well, I'm not going to delve into that conspiracy theory. I will just stick to the question. So basically, human rights is not absolute. It's not. It's all over the world. It's not absolute. Because if it were, then nobody will have the right to kill anybody. The states make laws that governs human rights, and they make the laws that revokes human rights. They say it is in the interest of the greater majority.
But in this situation, I know it is important that all of us should take this vaccine. But in a situation whereby you are not sure of what you are getting, sometimes you still have right.
That is another dimension.
That right is being destroyed. That you cannot even.
I wouldn't say the right has been destroyed. The right has been substituted or subdued. Let's go back to the issue and what we are actually discussing here. We're talking about the pandemic that has never happened to mankind before. We're talking about people showing no symptoms, walking into a place and affecting everybody they come into contact with by sneezing, by coughing, by talking. And so if, quote unquote, a vaccine is developed, that has the potential of curing or preventing you from catching the virus, the question is, would you or would you not take it? Then I ask you a simple question. I mean, we all grew up in Nigeria, and while growing up, you took meningitis, you took polio, you took, name it, different vaccines and all that our parents made us take. If we didn't take those injections or those things, would we be alive today? Is a question. To develop those vaccines, a lot of sacrifices were made. Maybe they made some mistakes. Some people died. They didn't get it right the first time. They learned from it. They corrected it. And then we got the vaccine and we're alive today to say the story. You understand? So when asking the question, what's in the vaccine? I'll tell you what's in the vaccine. What is in the vaccine is coronavirus. They put the COVID there, and then they put something that would arrest it while our antibodies build up the immune system in the bodies. It's just like the flu vaccine that they make people take in December. The flu vaccine consists of flu. The side effect of the flu vaccine is that you come down with flu. But when you come down with the flu, your body builds antibodies immediately, so that when you now come down with the main flu, your body already has the immune system to fight it. You understand? We should reduce the negativity around this vaccine because of certain perceptions and conspiracy theories and everything involved. If it's not fit for purpose, are we saying that in our mind's eye that, oh, there's a conspiracy against us black? Yes, there is. There's racism. There's everything, especially in the Northeast. We know it. We live with it day in, day out. But there are some white people who hate it. Some of them recognize it, some of them don't recognize it. But some are outright dead racist, like what Day has experienced. When it happens, I don't give two. I will square my shoulders up and I'll put my head straight. I don't give two. I don't care. But Day has the perception of noticing it the first and second time, and it wasn't a good thing. But in other clients, you just ignore them. For you're more healthier than they are. Maybe they are even doing you a favor. Maybe they are the ones that have the virus, and they are doing you a favor by staying 4 meters away.
That's right.
You understand? Maybe they are doing you a favor. Honestly, that's the way I look at it sometimes. Oh, thank you for moving back. You could go another step back if you don't mind. I would hate to catch the virus. You might be positive. Make them feel embarrassed by their actions. I walk around, like the other day, I was talking to people that, I walk around with a mask now, and I go around with a mask. So And I encourage people, if you can get it, to get it. It protects you, it protects other people too. So it's not enough, like Pastor said, it's fine to wash your face and all that, but it's always better to always have some prescribed protection. If you can get the mask, get it. Thank you very much.
All right, thank you. Before we come to the end of today's show, does anybody have anything to say, like word of encouragement to the community out there?
Be careful. Believe everything and believe nothing. Just be careful. That's all I can say.
Didi, do you have anything?
Well, I want to say that you know, I don't know, maybe I should have left this to the pastor, but I still have to say that except the Lord watches over a city, all you do is in vain. All right.
Yeah.
So we should keep an open mind and trust God, you know, and entrust our lives in the hands of God and trust that He's able to keep us, you know. Well, we should also understand that we always have a part to play.
Yeah.
Even in our salvation, we have a part to play. So if as serious as that, God can entrust us with our part, then if it's to wash our hands, if you're comfortable with mask, that's all right. Do what you can do to keep yourself, for your loved ones, for your family, and for us who love you too.
Thank you. What about Ngozi? Do you have anything to say to us?
I'll just encourage people to stay safe, keep being as clean as they can be, washing their hands, staying home, following health services directives, and basically staying in high spirits. That's the only advice I can.
Thank you. Pastor Uche,
No worries.
anything for us?
Yeah, I want to concur with everything that we have all said, and also to add to it that the spiritual controls the physical. Many people have taken poison by mistake and they did not die. So somebody cannot just put something or say something and again, predictions from whatever they are sure will happen. But if we hold on to God, we know that if this God we serve, if this Christianity, if it wasn't real, by now there will be no white man, no single one that will still believe in that Christian faith. The fact that they are not much into it the way we are is because their government is working. And so for some people, whatever they need is there. So what do they need God for? So what I'm trying to say is that we should always have it at the back of our mind that if God does not watch over a city, like they said, the Bible says that are ready for battle. Everything is ready, but victory is of the Lord. So whether we take precautions or not, of course we still have to pray. We still have to trust in God and put our hope, our confidence on Him. That's it.
All right. Thank you. And from me, I would say keep believing in God. Don't, if you receive any message from any social media, do your investigation, do your findings before you believe in anything you want to believe. And don't forget to always be yourself. Until next time we come your way, this is Opinions. Thank you. Bye-bye.